Cleft Lip and Palate, presented by Group MM 5.1, Davina, Beth, Anna, Olivia, and Yerin. What is cleft lip and palate? Cleft lip and palate is a lip condition that occurs at birth, caused by the baby's mouth not joining up during early fetal development. These can occur separately or can occur together, as the lip and the palate develop independently. The development of a child's lip usually occurs at 7 weeks prior to the palate, which occurs at the 9th week. In a normal child, the tissue travels forward and backward to help seal the lips, and in the 10th week of pregnancy, the mouth is fully formed. A child with this condition would have the two halves of their palate or lip not form properly. The lip and palate are the two main structures involved, but other structures that may not fuse properly include the soft palate and the nostrils. The cleft can vary in severity, from only cleft lip, either unilateral or bilateral, or both a cleft lip and palate. If the cleft does not impact or involve the palate, it is called cleft lip. This is formed at the top of the lip, where it could either be a small gap, partial or incomplete cleft, or the gap continues up to the nose, complete cleft. There are several conditions associated with cleft lip and palate, such as Pierre-Robin sequence, where the jaw is smaller and makes breathing difficult. Another condition, called Stickler's syndrome, a subgroup of Robin sequence, is involved with eye abnormalities that could eventually lead to blindness. There are many physical and psychological effects that stem from this condition. The associated physical effects may be painful treatments, hearing problems, or speech problems. Psychological effects could include insecurity, being bullied, and lack of self-esteem or confidence. In developing countries, children are not treated or operated on until later in life, so many of these psychological effects are exacerbated. Treatment for cleft lip usually involves plastic or cosmetic surgery. The number of surgery required depends on the extent of the severity of the condition. For cleft lip, the first surgery is usually done around 3 months of age. Treatment for cleft palate requires more surgeries that are conducted over 18 years. Initial surgery takes place around 6 to 12 months of age and helps reduce the chance of fluid development in ears and the proper development of teeth and facial bones. Children with this condition may also need bone graft surgery to help with upper jaw formation and teeth stabilization. This usually occurs at the age of 8, and additional surgeries are conducted to improve speech. The causes for orofacial clefts are unknown. However, there are several factors that can increase the chance of having a baby with one or both of these birth defects. These can include smoking, alcohol consumption, exposure to certain toxins, as well as the use of certain medications during pregnancy. While these are not definitive causations of cleft lip or palate, they have been found to increase the likelihood of this birth defect occurring. Recently, it has been thought that the causes of cleft lip and palate are genetic. Mangold et al. Found genetic evidence that cleft lip and palate is caused by a certain chromosomal alteration, which may be inherited from one or both parents. Cleft lip and palate is a birth defect. As such, infants are the ones affected by this disorder. 1 in every 600 to 700 babies in Australia is born with a cleft condition, which is one of the highest rates of birth defects. In 1/3 of families, there is a relative born with this condition and associated conditions. 2/3 of cleft patients do not have a genetic or hereditary history of the cleft condition or associated conditions. Depending on whether or not the issue is rectified, affects the age range in which this disorder is seen. It has been found that this disorder occurs more frequently in those from Asian backgrounds and less frequently in those of African and African American descent. Males are more likely to have both a cleft palate and lip. However, females are more susceptible to only having a cleft palate. Cleft lip and palate lived experiences. This next segment will look at the lives of 3 people caring for or living with cleft lip and palate. 29-year-old Iva, born in Bulgaria, moved with her husband to the UK while she was pregnant and has an 11-month-old son born with incomplete unilateral cleft. Fred is 6 years old in Uganda, Eastern Africa, one of the poorest countries in the world. And 24-year-old Amy in Glasgow, Scotland, who was aged out of Glasgow's Cleft Team Treatment Pathway Programme. Socioeconomic factors. In the UK, babies born with a cleft lip or palate are typically checked and treated in the Cleft Treatment Pathway Programme through the National Health Service, or NHS, which provides a range of health services, the vast majority of which are free at the point of use for legal residents of the United Kingdom. Iva's son and Amy are born in the UK, which makes them legal residents. The story is very different for Fred. Unlike the UK, Uganda is listed as a least developed country, a country that exhibits the lowest indicators of socio-economic development of all countries in the world. In the small village of Mukono, Fred's mother Sissy provides for her family by selling fruits, vegetables, and charcoal at the market. On a good day, she can earn $1.50. His father Yosef is a construction site labourer and hasn't been earning much over the years because of the lack of work. All the money scraped together by Fred's parents pay for food and the rent on their one-room house, where Fred spends most of his life. Cultural stigma. When Iva and her husband were informed that their son had a cleft lip during her 20-week pregnancy scan, she describes hearing the diagnosis as the most awful moment of her entire life. She felt devastated. The diagnosis came as a great shock to the couple because in Bulgaria, mothers that are expecting children with clefts are typically urged by health professionals to terminate their pregnancy or put their children up for adoption. Iva describes the Bulgarian healthcare system as far behind in their understanding of cleft lip and palates. There are no specialist hospitals, and multidisciplinary teams are not common in Bulgaria. She felt that her child would receive poorer medical care and social acceptance in Bulgaria, so she and her husband decided to stay in the UK. Because of his cleft lip and palate, Fred's speech is slurred and others have trouble understanding him. He can't go to school and doesn't have any friends. Other children ridicule and tease Fred, and he has had stones thrown at him. Some people believe he was cursed and fear him being near them. People with cleft lip and palate are called ojok, a North Ugandan phrase which translates to a person who should not be in society. It is often associated with things such as bad spirits and bad omens, something of impure nature. Exclusion and loneliness is Fred's reality. Hidden, he exists in the dark corners around the edges of life. He has learned to stay out of sight and hide in the shadows. At home, he stays indoors and only admires other children from afar. Amy, on the other hand, may have looked different, but didn't feel different, as she wasn't treated differently growing up, which she believes made all the difference. She feels very lucky to have never been bullied as a child, as she was outgoing and confident. If other people said something to her, she would tell them that she had a problem with her lip, and that's why she looked different. She understood that people were just curious. Having the cleft enabled her to meet fascinating people, including her best friend, who also has cleft lip and palate. Still, she is dissatisfied with her appearance, and gets more and more cosmetic surgery in hopes of waking up and feeling she's perfect, like a model. She perceives her biggest challenge as hoping one day she will feel comfortable and happy in her own skin. Access to health services. Both Iva's son and Amy have access to many health services to support them, such as the NHS, paediatric cleft nurses, and the Cleft Lip and Palate Association, or CLAPA. As previously mentioned, babies born with a cleft lip or palate are typically checked and treated in the cleft treatment pathway until they are 21. The cleft treatment pathway provides support and treatment services as a multidisciplinary team. These usually consist of a clinical nurse specialist, an orthodontist, a pediatric dentist, a speech and language therapist, a surgeon, an audiologist, and a clinical psychologist. Iva hopes Bulgaria will follow in the UK's footsteps. She hopes the children there will receive a high level of professional help, like in the UK. The same cleft team treats the client throughout the program, and thus Amy felt able to make friends with them. She felt they worked tirelessly and delivered the highest level of care to their patients. She was able to get many surgeries over the years, most of them for functional purposes, but recently for cosmetic reasons. The only thing she feels that is missing is a cleft service for adults in Scotland to better support adults with cleft and their partners. For Fred, people say that it's a miracle for him to even be alive. Children who are born with cleft palates have trouble feeding and swallowing. Infants, especially in Uganda, die within a year if no surgery is performed on them. Only due to his mother's sheer determination has Fred lived healthy and well-nourished. Although Fred's parents know that surgery could repair Fred's face and give Fred a second chance at life, they can't afford transportation to the hospital, let alone surgery bills. Through charity organisation CBM, Fred was able to get surgery, care, rehabilitation and support from the charity that his parents could not otherwise afford. From this analysis, it can be seen that cleft lip and palate can affect individuals from different countries and cultures in very different ways. While some sufferers of this condition have adequate access to healthcare and are treated no differently in society, others are subjected to cultural stigma and may not have access to the healthcare and surgeries needed to correct the birth defect. These differences in attitudes concerning cleft lip and palate are significant, as it outlines how various cultures around the world respond to physical disorders and the people who have them.